Hi everyone. It's been a while for this session, but as you know, I've been abroad for conferences and some other research purposes. So this is a new episode on non-pharmacological support for patients living with long COVID. As always, I focus on young people, so children, adolescents, and young adults, like less than 30, 40 years old, which are those I follow in my hospital. So this today it's actually an hybrid on pharmacological and non-pharmacological support, but we are still focusing on how help people with long COVID. So I'm talking about people that already have a diagnosis of long COVID, on how to manage their quality of life. So we talked about the importance of families, the importance of school and working environment, the importance of using devices like wheelchairs and whatever. So this episode will focus on reinfections. Although we don't have yet a lot of data about what I'm seeing, honestly, my clinical practice and the daily clinical practice from several of my colleagues dealing with patients with long COVID is straightforward, meaning that the large majority of patients with long COVID, when they get a new viral infection, usually COVID, but also other viral infections, their quality of life worsens significantly, meaning that patients may be already in a severe long COVID uh, spectrum and they deteriorate. Or sometimes we have patients that have had long COVID for months, 2 years. Maybe they were gradually recovering, then they catch COVID or another flu like infection, and their quality of life, energy, and symptoms drop suddenly as they are having a new long COVID. So I'm not aware of studies that have documented that, but I'm ready to put my face on this statement. Although this should not be very much surprised because we are having new studies showing that, and even patients that don't have long COVID are at risk of developing long COVID with COVID reinfections. So this is somehow reasonable. So in general, I when I talk about with my patients with long COVID on how to deal with daily life, support or whatever, I tell them very directly and strictly that COVID reinfections and in general viral infections put them at risk of deteriorating. So this is a very challenging topic because we don't live in a sterile environment, and it's very 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 difficult not to catch viral infections. And this is why this episode will be hybrid, non-pharmacological and pharmacological. In theory, ideally, everyone in the world should wear a mask, um, particularly to protect those fragile people, like patients with long COVID. I will define them as fragile patients. However, as much as we want to advocate for wearing masks and whatever, particularly in close environments, the 99% of the global population is not willing to use them anymore. So, I've been accused and severely attacked on social media for posting a picture without a mask when I was in the United States. But no one is wearing them. People in some places it's not even legal to wear a mask. So what I suggest to my patients is not to hope the others will help, will support you in protecting and reducing your risk of reinfection. So it's unfortunately everything on your shoulders. So although I do think masks are useful to prevent infections for the single person, at the patient at the population level, as no one is wearing them anymore, their usefulness is very much limited. But for the single patient, it is. So I make aware patients that catching infections is a risk factor for deteriorating. So I suggest every time to my patients to wear a mask, hopefully not a surgical mask only, but a very good mask whenever they have to be in at-risk environments, which are hospitals or any closed environment with poor ventilation. This is a first point. Secondly, if, for example, you are a parent of a child with long COVID attending school, another useful thing that you can do, as schoolmates are not going to wear a mask. This is, already defined. People and children are not going to do that. We are having growing evidence that air filters and air monitors can help in reducing the burden and the risks of viral infections in closed environments. So you are either are a parent or you are a worker. You can talk with teachers, with the bosses of schools or of your work, of your job, to advocate to use air filters and air purifiers and air monitors, which can really be another step to reduce your personal risk of catching COVID or other infections. It's important that your family members will be up to date with all infections, with all vaccinations, meaning also the flu vaccinations, and also I suggest the COVID vaccinations for your family members, because at least for 3 to 6 months, so maybe in winter, it's good that your family members catch up with influenza, flu, and COVID vaccinations, as they will reduce the risk for them to catch the infections and to transmit them to you within your household. About vaccinations in patients with long COVID, this is a more complex topic in my opinion, because patients with long COVID sometimes can improve after getting a COVID vaccination, but many times patients with long COVID report a worsening of their long COVID symptoms, particularly if they get an mRNA vaccine. Probably we don't know yet exactly, but this can have something to do with the spike protein. So, according to your risk of having a severe acute infection, you may either suggest your close relatives to be vaccinated, or you may consider a vaccine with a protein-based vaccination, like so wherever it is available in your country. And so will be masks in at-risk environments, so every closed environment, washing your hands and your, so also advocating for your caregivers or family members, your partners, to be as careful as possible to avoiding infections. And maybe they can also wear a mask when they attend at risk environments. Advocate for health filters, catch up vaccinations, particularly for your household members. And in my opinion, a very important point, until we have better evidence, and this is actually what I suggest to my patients, that is that in case they catch COVID again, already during the acute infection, whatever is the severity of acute infection, so most of the time is an acute, mild, or sometimes even asymptomatic infection, I do suggest to treat the acute infection, because in my experience, there is a higher risk, more than 50% risk of worsening your pre-existing long COVID symptoms. So I always suggest to either use metformin. We have quite a few trials now showing that metformin has antiviral activities, and when used during the acute infection, reduces the risk of developing long COVID, or particularly for patients younger than 18 years of age, where it can be more challenging to use metformin, as we have had less experience in this population. I suggest to take Paxlovid, as this is used to to treat teenagers. We have younger children. We have evidence for that. So reinfections, whatever is the severity, if you have long COVID, my suggestion is to treat the viral infection, whatever is the severity, until we have better evidence. But I don't think we will ever have new studies on this topic in regard. So take care. I know it's impossible to have a 0% risk of getting new infections, but I think being aware of these strategies may be important, including advocating with your family doctors to prescribe you the antivirals if you catch a new COVID infections. And I can also consider with other treatable viral infections in case you catch herpes virus or the flu, for example, which are viruses for which antivirals are available, or for example, a CMV infection for which we also have antivirals. So we will see soon for each other soon for other podcasts, blog posts on every Sunday, or a live Q&A session. Please, if you like this episode, leave some comments, like and share it either here or on social media or YouTube, because this is extremely important for us to keep working on this topic. Knowing your feedbacks is important, because otherwise, if we have the feeling these videos are not useful for you, we will stop, of course. So please let us know. Best wishes and see you again.